I'm Dr. Conn, Interventional Pain and Neurology, and today I'm going to talk about Alzheimer's disease and the revolutionary blood test that can help us track who is at risk for Alzheimer's disease, track the progression of the disease, and see if our treatments are actually improving the patient and reversing Alzheimer's disease, which is so exciting. That's actually possible now. So what is the protein we're going to talk about? The name of it is phosphorylated tau 217. And so this protein can be found in the blood. It's by blood test, which is so nice and easy for people because in the past we've had to do lumbar punctures where we go between the bones and the spine and withdraw fluid to check this, which is hard for patients to endure, and sometimes people are afraid of that, which is completely understandable. But now we can actually draw blood to find this protein level. A group in Sweden discovered a protein called the p-tau 217. So what the heck is that, and what does it have to do with Alzheimer's? Well, it's a phosphorylated tau protein that can be measured in the blood, and it turns out that this protein tracks Alzheimer's disease. So the protein can start to rise in the blood 20 years before people present with full-blown Alzheimer's disease. So this is really revolutionary, and it creates a lot of important questions. What exactly is being measured with this p-tau 217? Well, there are normal tau proteins and they're neurofilament proteins. So in essence, they're the scaffolding within a cell. But they can start having molecules deposited on the side of it. And we call that phosphorylation, and that's where the P comes from. And so when all these groups start being deposited on that protein, it's like a piece of paper that can't be folded in half anymore. It's all crinkled up and can't do its job. And those are the tangles that deposit in the brain when people have Alzheimer's disease. So this brings up very interesting questions. We can predict who's going to get Alzheimer's disease like 20 years before they get it using this blood test. And before this, we needed to actually do a lumbar puncture to get the fluid around the spinal cord and brain, which is an invasive procedure. But this is actually much more accurate, and it's so easy. This test is now commercially available for about $200. In America, you can get it at LabCorp and Quest. So who should actually get this? That's a good question. People that are at high risk for Alzheimer's disease because of family history, and perhaps they know they have the genetics. Those are folks that might want to consider getting it, but it's actually a really complex question. Oh, you have it, what can be done? Well, this is another very exciting new area. This protein can be lowered, and we can slow the onset of the disease. So that's crucially important. So how do we know it can be lowered? Well, exercise, for one. Exercise can lower the protein, and we can track it in other lifestyle modifications. And where's the fill going? I'm going to talk in one of the next videos about preventative neurology, all the lifestyle changes that can be done to lower the protein. But there are also drugs in development that can lower the protein. So there's a lot of hope, but it still people need to think very carefully about getting the test. So there are also other proteins in the future that are being developed to potentially track Alzheimer's. This is just the first of what will likely be a number of proteins that can be tracked by a blood test to follow who's going to get Alzheimer's, how fast is it progressing, and then we're likely going to track these proteins to see who are we reducing the risk for. Are the drugs and lifestyle changes actually reducing the protein to slow the set of Alzheimer's? So in our next video, we'll talk about exactly what lifestyle changes are needed, and I'm going to rely on the research for Dr. Richard Isaacson for that video. And if you like what you see, please like, subscribe, and share it. Thank you.